Hi everyone. In this video, I will be talking about the various things that I've noticed changed in units and hospitals due to the pandemic. I thought it would be interesting to hear what my hospital did, and I'm curious to know how other hospitals have changed too. In this channel, I talk about all aspects of nursing. If you want to learn about nursing, consider subscribing as I upload a new video every week. Also, be sure to give the video a thumbs up if you found it useful, as it helps others see the video as well. The first and most obvious change was wearing a mask for 12 hours. This was actually more difficult than I had thought. Wearing a mask for this long was so incredibly uncomfortable, but even more in the emergency department because you're often running around so much. Especially for me, as I often have facial hair, which was another thing that I had personally changed. Due to the risk of virus transmission, I had to shave all my facial hair often, which was a bigger problem than you would think. My beard grows incredibly fast, and when I was wearing a mask, my hair would get caught on the mask, and it would lead to things like mask fibers being all around my face. Another change that was interesting to see was the flow of patients throughout the hospital. During the initial months, there were massive changes because the patients needed to be safely placed on floors which did not expose them to patients who might have COVID. As a result, everyone that had any sort of respiratory symptom in the emergency department had to be swabbed and was either kept in emergency or was placed on a floor for patients who are waiting for COVID results. This meant that patients that had COVID must be placed on a specific floor and a separate floor for ones that were not positive. This was a pretty massive change, as they had to basically remove and adjust certain floors of the entire hospital. Another massive change was the fact that hospital protocols needed to be created to accommodate for the unknown. For example, protocols needed to be in place for pregnant women in labor who were COVID positive. People who enter emergencies who were COVID positive needed to have a safe and effective way of limiting risk of transmission. And also, people who were very ill from the virus needed to have a separate team to provide safe and effective care quickly. This was all huge changes that needed to take place in a span of few days to accommodate for a pandemic. It also meant that there were some floors that needed to have construction done very rapidly to accommodate for this change. The other change that made working challenging was that staff rooms needed to be changed to adhere to social distancing guidelines. Staff rooms are typically quite small, and this meant that we often did not get a chance to eat food in our staff room during common break times, such as lunch or dinner. As a result, many of us had to take breaks in common areas, but so did many other nurses on floors, which resulted in limited space to have lunch or dinner. This may seem like a minor detail, but when you're working for 12 hours and just want to have a place to sit, relax, and eat lunch, this can get quite annoying quickly. Surgeries were rescheduled. This was probably the most devastating for the general public. Many patients that were required to have surgeries for their chronic pain problems were no longer able to get it when they were scheduled. This meant that so many patients were delayed and as a result had to live with decreased quality of life. Outbreaks were very common but late to be reported. This is probably the most frustrating. There were times where there were outbreaks declared in places where we did not know about until a week or two later. As you can imagine, this was frustrating, especially if it was a common area. For instance, senior homes had outbreaks of COVID, but they were not reported to us until it got so bad that we started to notice an uptick of patients from certain residents. This meant that everyone was wearing PPE for every single patient, as we did not know where the next outbreak would be. Overall, I do not believe that this was the fault of anyone. The pandemic requires such rapid changes in places, and it was a learning experience for everyone and the world. However, being on the front lines of this pandemic, I saw so many sad things occur, and I want to speak to many changes I noticed. I would love to hear how your hospital changed and if there was anything I missed that you would like to share. Let me know in the comments below. Thank you so much for watching, and I'll see you in the next video.